So Tracy, I know you're really, really passionate about fillers and the artistry of fillers. So can we talk a little bit about that?
Yes, now this one I could go on forever about, because I think filler work generally is misperceived by the public, misconceived by the public. They don't understand. They see so many overfilled faces, both in the celebrity world, on television, in Friends. So the breaking all those myths and misconceptions about fillers is one of the biggest things I do in my clinical practice. I love fillers. If I had to go onto a desert island with patients, I would take filler every time. And
Would that be your desert island?
That would be my, forget the mascara and the lipstick. I would go for probably concealer and fillers. So fillers you can do pretty much anything with if you know what you're doing. And I love the natural results they give. So with fillers, again, it's about artistry. It's about looking at a face. It's about assessing need really, really well. It's about taking the time to look at the face from every angle. It's about really trying to hook into what a patient wants, but quite interestingly, what a patient will often come in and ask me about and talk about will often be completely different to what I end up doing and what they end up understanding. So it's about educating the patient about actually what they might think they need is not necessarily what they do need.
So let's talk. So people are put off because they see the overfilled lips, the overfilled faces, which we've all seen. But a lot of people have fillers, and you would never know.
I know, which is wonderful.
And that's our aim, isn't it?
Of course.
So can I just pin you down onto different areas? So let's just start. Can we start top? Start at the top, work down, and tell me about.
So pretty much you can, within reason, you can put fillers anywhere. So we normally are used to using our toxin on brows. However, you can actually put deep on bone, and feed filler across the brow, across here. Sometimes you can actually feed it across here if there's sort of dents and dips. But you can actually support and give structure to particularly the lateral brow with filler. That helps the double eyebrow look, which I've got the double eyebrow, all the lines that go above the eyebrows. It will give, because that's largely not only due to, as we know, descent of the brow, but that's due to bone loss. And so actually by supporting it, the eyebrows lift naturally, the lines soften, and it's actually a really beautiful aesthetic look. You can treat the glabellar frown lines if you know what you're doing with filler and if you're aware of your danger areas, which I am. And I routinely fill glabellas with no complications.
After toxin?
Sometimes, yes. When you've got, I'll combine it. But when patients need it, we do it, great result. That's the thing often they're the most impressed by. A lot of newer injectors are quite nervous about treating the glabellar area with filler, which I understand why. I'm good. But actually you can get fantastic results there. Then again, this temple hollowing area, big area of aging concern, particularly for slim women like me with thin skin, that depression in the temple.
It's quite subtle, isn't it? I mean,
I routinely feel here. And it just gives, particularly in women, it just gives a very youthful, I call it infinity cheeks. It just gives this beautiful, harmonious, it morphs the brow volume into the temple, right through down to the cheek. And if it's done well, it just looks stunningly beautiful. It makes the eyes pop more. It brings out the eye a little bit more. It just looks lovely.
Infinity curve.
Infinity cheeks. But
it
just looks beautiful. So you've not got the we've all seen filler here where people have been filled in these areas, and now with the way that people are doing cheek fillers with coded treatments, all kinds of things, you can often see this is too full and then this is left behind. So you've got to be looking at what you've got there. You're not following a formula.
Every face is different.
Every face is different. And then that goes down again to an interesting area, the tear trough area. We do a lot of tear trough treatments. Again, expertise.
Controversial, isn't it?
I like doing them. I think, again, less is more. If you know what you're doing and you're used to treating safely, still an area of consideration, but you can get some very nice softening of the under eye hollowing, and it can again really bring out the eyes.
Any tips to be as safe as you can in the under eye area?
Get brilliant training. I mean, you know, I could talk about techniques and what you should do. I use needle. I don't use cannula actually. But I know actually probably cannula is the best way to start doing your tear trough. I use needle purely because it's the way I was trained, the way I'm comfortable with, and I'm very, very careful and precise. Very careful, and I always under-treat and bring a patient back. So this area can really rejuvenate by putting filler in the upper third. You can give beautiful support and a very soft, gentle lift. Mid-face, as we know, we tend to focus on a lot as clinicians, not the big fat apple cheeks. The secret here is to look at a face in repose and a face when it's animating, because you can do a mid-facial, you know, cheek volume support. It can look great when there's no animation. As soon as they smile, it just... But again, if you put it correct placement and it's not superficial, you're unlikely to get the big, fat, puffy cheek look. And that's what, again, a lot of patients need to be educated on. They say, well, I've seen so-and-so, they've got huge cheeks, and when they smile, it's all overdone. Well, that's actually often, you know, may not necessarily be too much. It probably is, but poor placement as well. If it's too superficial, it will look puffy and swollen. So deep on bone, strategically placed, but we tend to work more now, as you know, indirectly. We tend to work more to give a little bit of volume here, but to give more support and lift, because again, as the older women particularly, and men, but older women, men seem to lose volume over here, particularly the gym phase.
Absolutely. Where do they lose volume?
Men lose volume in this mid part, don't you? So it's sort of here and here, whereas women often really flatten out in the preauricular area. So you see mature women, they get really, really hollow here, and they almost get this sort of fullness here. So everything's got to go on.
So they bunch up in
that. So they look full, and the labial folds get more pronounced, as we know. They get the thickness here, this fullness here, and then there's nothing here. So again, a young face will have this sort of very harmonious volume here that again morphs into here. So we actually do a lot of work in this area here just to give a little bit more support and structure and soften that transition between the cheek and here.
Because a youthful face doesn't have many shadows, it's sort of smooth
and it's contoured and it's lifted and it looks beautiful, and again we do more and more. Again, in the past we used to chase the marionette lines, and well, now we don't do that. We inject deep on bone to support the jaw, you know, to support the mandible, make this look smoother, more contoured. We can even sort of slightly tilt the lip if we're clever, and if in some patients it works well, some patients it doesn't work so well. But just to redefine, there's new products coming out that will redefine this jawline here, and again help project the chin volume. So you've got this, you can work upper third, mid third, and this lower part of the face and chin, and support this. And I do this a lot, just to tip the chin and extend the chin just very subtly, so it looks more useful.
You talked a little bit about the jawline itself. How do you...
Yeah, I mean, there's again new products coming out for there, but just using a cannula along deep on bone, just to give a little bit more support. I think this area where we lose bone, particularly as women, I talk to patients about this part from the angle of the jaw to the tip of the chin being like a curtain pole, and if actually you chop, you get a bit of bone loss, you chop the curtain pole short, and that means all this.
That's where you get the jowls.
So actually, if you just can extend it just a little bit, you will soften the jowling a little bit. It's all subtle. We're never trying to pretend to be plastic surgeons.
No.
What we're trying to do is give best result with a very strategic, clever, artistic approach to rejuvenating a face.
You know what I'm going to ask you now. So Tracy's top tips for fillers.
I would go to someone who is really experienced with fillers, who you research and know does great work with fillers. They are often poorly done, even in people you would expect would not give poor treatment. So do your research. Ask to see, always this is the case, but ask to see before and after photographs of that person's work. That's very important. And get a practitioner who really can explain what they're trying to do trust what they do, and once you find the right person and trust them, take their advice and give the best advice. And that's the other thing. Everyone is chasing the perfect treatment.
Yeah.
Everybody's chasing the best cosmetic doctor in the UK. I'd say that doesn't exist.
Yes.
What exists is, if you've got an experienced person, the right person for you.
Yes, absolutely.
The person that engages with you well, understands you, and let them take over the whole care, a bit like a piece of art.
Yes.
You wouldn't have a person doing a blob of paint while somebody else coming in.
Yeah.
Get them to take over your care and let them evolve with you and get the right treatment for you.
So really sort of find the right person and stay with them, like relationships.
Give them a chance, it's a marriage.